Hi, my name is Raghav Agarwal and I'm a fourth year medical student at the Wake Forest School of Medicine. I'm going to give a lecture today to give you the basics of how to read an abdominal X-ray. This here is a general abdomen X-ray. So just to go over some X-ray densities, when you see gas, it's generally going to be very dark, almost black. Any calcified structures are going to show up as white, as you can see here with the bone. Any soft tissues will be gray, as you can see here. These densities are a little grayer. Fat will be a little darker gray, and any metallic objects will be a very intense white. So there's many frameworks when looking at X-rays, such as the abdomen X-ray, just to make sure that you cover everything that you're looking for. An example for the abdominal X-ray is Abdo X, where A stands for air, B stands for bowel, D stands for densities, O stands for organs, and X stands for external objects. So to start with our air, generally air should only be seen in the lumen of the bowel. If it is outside that, there is usually something pathological going on. The largest volume of gas that you're likely to see on an abdominal X-ray is seen right under the diaphragm, and you can see this in the case of a perforated viscus. As you can see here, this is the diaphragm right here, and this density right here is air, so this is abnormal. So to move on to the bowel portion of our mnemonic, normal small bowel will generally be located centrally, as you can see here, with structures known as plicae circularis, which are these little structures here. Small bowel will generally only have a small amount of air. As you can see, there's not too much dark densities here centrally. In contrast, normal large bowel is located peripherally, as you can see here, and contains structures known as haustral folds, which are these represented right here. Normal large bowel usually contains some air and fecal matter. As you can see, this dark density here is representing air, and then fecal matter here. There is a 3-6-9 rule with the X-ray, where small bowel is generally 3 centimeters, large bowel is 6 centimeters, and the cecum will be 9 centimeters. This is useful in recognizing any sort of obstruction or constriction going on. As you can see in this image, this is representing small bowel obstruction, so this is a little enlarged, and you can see here there is also air fluid levels. That is another piece of evidence for an obstruction. You can also inspect the inguinal regions for evidence of hernia on the abdomen X-ray, as well as some signs of inflammatory bowel disease. One of them is thumbprinting. As you can see here, you can see this edge of the small bowel looks like thumbprints. Another sign is the toxic megacolon. As you can see here, the colon is very enlarged, representing a complication of IBD. For the next part of our algorithm on reading abdominal X-rays is densities. So on X-rays you can see bones, therefore you can look for fractures, metastases, or even arthritis. The bones that are visible on the abdominal X-ray will be the lower ribs, the vertebral columns, the pelvic bones, as well as the femoral head and neck. Here in this image you can see an acute right 6th rib fracture. On these X-rays you can also see calcifications within the organs, such as a calcified renal tract, gallbladder stones, or calcified vessels. Here in this next image you can see a stone that's located near the left uretero-pelvic junction in the proximal left ureter right here. So the next part of examining an abdominal X-ray is the organs. So you want to make sure to look at the contour of the organ as well as the size. You want to inspect the lung bases, which can show you consolidation or pleural fluid. Organs that you can see are the liver. The gallbladder is rarely visible, but you can look for cholecystectomy clips or gallstones. You can see the stomach, depending on how much air is in the organ. You can also see the psoas muscle And here the lateral edge is a straight line on either side of the lumbar vertebrae and the sacrum. You can also see the kidneys, and if you remember, the right is lower than the left due to the mass effect from the liver. You can also see the spleen, and then you can also see the bladder, which is variable depending on how full the organ is. Here is a good picturization, so you can see the stomach, not so well, but you can see the colon here, you can see the liver here, you can see the gallbladder here, and here's the spleen, the pancreas, the kidneys here, and then the adrenals would be on top. This is the L4 vertebral body and the pedicles. You can see the transverse process and the spinous process, and these right here are the psoas muscles. The final part of our inspection algorithm is external objects. Here you can look for medical devices such as GI tubes or IUDs. Here's an example here of a feeding tube that's coursing through the esophagus while it's blue and then passes into the stomach as it's green and terminates at the gastric antrum. You can also look for foreign bodies such as any bullets. You can see here a hyperlucent bullet. And you can also look for any surgical clips, for example, cholecystectomy clips. As I had mentioned, there are many different algorithms you can use for inspecting abdominal X-rays, but this was one of them, the ABDO X. Thank you so much for your attention, and please leave any comments or questions down below.